Hi, my name is Dr. Rahil Kamar Siddiqui and I'm the director of SITCAM Technologies. I have a background in health informatics with a PhD from Manchester University in UK. Having spent over a decade in the NHS in UK as also the Department of Health, and having represented the country in various healthcare IT standards initiatives, I had a passion and a desire to bring back my experience and skills to India and help with the health informatics initiatives in India, to get them on the level of healthcare and IT that other countries in the Western world have been able to achieve. So with that dream, I relocated and I'm in India now, running this company called SITCAM Technologies. Our product is Eventus Life, to help integrate the patient data and allow the patient data to flow with the patient with adequate consent. So looking at a series of topics which I would like to be covering, focusing on healthcare in India and its current situation and where and how we can help achieve a better result and a better positioning of India in the world healthcare market. A recent study by the UN General Assembly showed India to rank 143 amongst the 180 countries that participated in the health index. Not a really good start for India, but it does show that a lot of work needs to be done and a lot more initiatives need to be taken, not just by the government but also the system providers who are engaged in the healthcare services within the country. So the 143 index ranking was primarily based not just that India was performing poorly in health, but also that there was a lack of adequate data available to help gauge where India stood in various categories, whether it was determining maternal mortality or neonatal mortality, or whether it was indicating what kind of disease indicators we had within the country. There was a lack of good quality data to enable such indexes to be ascertained. Now, when we talk about good quality data, it comes to the systems that are being used within healthcare organizations to record the data that is being observed or analyzed about patients. We know that we still focus a lot on paper records and the use of paper records between different departments of a hospital or even single-handed clinics or polyclinics. The use of clinical systems is few and far between. There is a lack also in the quality of the clinical systems being provided by the different vendors, so that even if there is a system installed, a lot of it is focused on the administrative aspects such as patient registration and billing. And very few of them are focused on the clinical consultation, the actual recording of the patient history, allergies, the problems that the patient has come in with, the diagnoses that have been made based on examinations, and the prescriptions that have been given. This data is not readily available within systems. Often they are recorded as free text or even scanned, pictures being taken of paper held records and being uploaded into the system vendor repository. That's not really the answer to helping achieve good quality data within India. The focus really has to be that we not only engage in the administrative aspects of hospitals and clinics, but also enable and encourage clinicians and other healthcare professionals to religiously record the clinical consultations that they perform, and also to ensure that the consultations that are being done are not free text, but we have standardized data and controlled data being fed into the system so that we can make some sense out of the data being fed in. Obviously, if we don't have good quality data, we're not going to have good quality data outcomes and measures that we can analyze and report. The government of India has initiated a lot of efforts towards this. The integrated healthcare, the IHIP program is one of those that is encouraging system vendors to get on board to allow that sort of interoperability of healthcare data. We also have the government of India who has purchased the SNOMED CT license to enable the coded recording of healthcare data at the point of care rather than later on through secondary use. There are a lot of initiatives. It is up to the country, up to the vendors, and up to the end users, the healthcare professionals, to start making use of it and take advantage of it. There is also an EHR standards for India that has been published by the Ministry of Health and Family Welfare that indicates the standards that have been recommended for use within systems, clinical systems. With a lot of knowledge on standards and their implementation, I would like to go through a series of the standards and how to easily implement them within the systems. So in my next talk, I will be covering ISO 13606, which is one of the standards that have been recommended by the Ministry of Health, and how we can use that to structure the data that we are presenting to the clinician or the healthcare professional for clinical record keeping. Thank you.